thank you for opportunity to represent Lithuanian experience on developing supported decision making. So I am from the Ministry of Social Security and Labor, and also I am a team member of Agency of Protection Right of People with Disability in Lithuania, where we are creating the supported decision making services. But first of all, I would like to introduce you with the current context and situation of Lithuania. As you saw before, in Lithuania, the system of legal capacity restriction have many challenges, and unfortunately, in Lithuania, legal capacity can still be limited for people with disabilities in partial areas. The basic algorithm is that a person's relatives, like spouse, parents, adult children, municipality, or prosecutor, may file a statement to the court and ask to restrict a person's legal capacity. In addition to some formal documents, psychiatric expertise and social worker conclusion is given to the court, and the court then makes a decision and determines the areas where a person's legal capacity is restricted. Then a person got a guardian who can make all the decisions in that restricted area. And you can see in this slide, there is no way to talk about the accessibilities to some services. But what we are doing now with the supported decision making, we are trying to change this algorithm and to say stop in some areas. The good news is that for 2 years, Lithuania and the Ministry of Justice, together with the Ministry of Social Security and Labor and the Ministry of Health, we were preparing the incapacity reform, but it was the job of our last government, and it wasn't implemented because we had some discussions and different attitudes in our parliament. But the hope is that our new government that just started her work, the reform of legal capacity has as a priority in this field. So, as you know, in providing supporting decision making, we are really connected with the need of this reform, because we are working with many of communities, with legal community, with social work community, with health sector, with community services, and we also always have some boundaries. So the first thing that is, and the challenge, that a person is not considered as a legal subject, but an object. And our academics and NGO sector always states that this is a juridical death of a person, and we fully agree of it. And what we see and what our research shows, that the assessment of a person is based on the paradigm of defeating the person, accessing what the person cannot do, but not what the person can do with the help and support. So every time when we are working individually with a person and some other organization, we have to change this question. Also, it is very connected with a person's institutionalization process, and as a country, what we are implementing the institutionalization process, it's also very big challenge not to send persons to the institutions. So it's very connected, as my colleagues mentioned before in previous two presentations. And in most communities responsible for ensuring the rights of a person, a defeatist approach dominates. We still have this medical approach, but not a social and human rights ensuring approach. And also, I would like to specify that this is a very broad and complex problem, because we have many interests and many communities with different attitudes toward people with disabilities. So first of all, this is interests of applicants, or family members, or municipalities who often attempt to appropriate a person's property or discard an inconvenient community member. And also what we are seeing, that a person is not participating in this limited capacity algorithm. He's not representing himself. So our main task is to help him with a supported decision making, to represent himself, and to help him to save his rights. Also, we see that there is a very fragmentary assessment of a person's situation in social work and also in health communities. They are not connected, and we see that this evaluation is very fragmentary, and when you are making a decision, you don't know this person in personally. You need many of time to get to know for this person. So we are also trying to change this practice with supported decision making. Also, we have problem with formal representation by lawyers in court, because often the lawyers who has to represent the person, they are not connecting and meeting the person, and everything is doing by only the documents. And also in our civil code, we have a lack of alternatives. And one of the best example is when a child with disability becomes an adult, then his family members cannot help to open bank account, to use his money for supporting the individual needs. So our support decision-making services is not only working the person individually, but at the same time, every day we are working with some communities. And here there's 4 main communities. The first is the healthcare community with specialists who are performing forensic psychiatric expertises, also doctors and mental health centers, not to see to a person as having a diagnosis, but also to help to make him the community-based treatment. Also, there is questions with the legal community, with judge, lawyers, and notaries to help person to represent himself and things like that. Also, the social help community, where we have social workers who are preparing court reports. We are trying to change these practices, that you need to know person for a longer time, and to talk not about the conclusion, but about the inclusion of community-based services and things like that. So it's also connected with social work providing services. And also we have a new community. This is a supported decision-making specialist. I will talk about in the next slide. And another community is complex community, where we have policy-making communities. As I told you, we had challenges in our parliament. Also, we have 3 different ministries. And we have municipality administrators and also the commissions for reviewing the status of incapacitated persons, where we see that it's also very stagnatory. So we started piloted supported decision making since 2020, and first of all we wanted to try it as a method. So we asked the social work and NGO organizations to practice on other countries to pilot these services and to try to do this, and as a method, our results showed that this is very good method for individual life, but also we saw that there is some challenges when we meet those communities I mentioned to you before. So since 2024, we started a new, very huge project in the Agency for the Protection of the Rights of People with Disabilities, and now we have supported decision-making specialists in almost all Lithuanian municipalities. And also in this project, we have lawyers who work with the representation of people with disabilities. So supported decision-making specialists, they work in the individual level, but when we see that this case has many other issues with court, if you want to give a restricted capacity back and other things, these lawyers help to save a person's legal capacity. But this is a project, and we are very connected with the need to change our civil code, the Ministry of Justice. And very shortly about experiences in supported decision making, we have been done the project, and we see that we are improving psychosocial.
I kindly ask you to soon wrap it up. A few minutes left. Thank you.
Yeah. And we see that there is an improving of psycho-emotional health of people with disabilities, because it's the first time that we are changing the work from group to individual, and they represent the needs of people with disability. And we see that there is a changing the culture of social work organization. As my colleague from Latvia mentioned before, we have the same result of increasing access to social, health, employment, and other services. We work a lot with changing the public attitudes, and we have some historical attempts to prevent the limitation of legal capacity of persons with disabilities. And these cases that we have just very few, this help us to go forward to save and to ensure the rights of people with disabilities. So this is my last slide, and now I am ready to answer your question. Thank you.